So, how was school today?
It was alright.
I heard you had a test in dentistry with Miss McBride. How was it?
It was okay, but I think there's like some parts I can improve on. For example,
Wait.
this part.
Jess, are you okay?
No, look at this.
What is that?
My tooth.
Ew, get that away from me! Come on, Jess, we have to go to a clinic right now. Let's go. Hurry up, come on.
Hi Jessica, I'm so sorry that this has happened to you. It seems like you need to watch out where you walk because this job I cannot do.
Huh? You're the dentist. You're supposed to know what to do.
Yes, ma'am. I am the dentist, but this job is for a periodontist.
A periodontist?
Yeah, a periodontist. I'll schedule an appointment right away.
What's a periodontist?
I don't know. Let's look it up. A periodontist is a type of surgeon.
What?
Hi, I'm Miss Know-It-All. I'm your local broadcast interviewer here to interview people about our topic today. Periodontist. Let's go. What's a periodontist?
I don't know, I dropped out.
Me? What am I? I'm a periodontist, or aka a dental surgeon involved in the diagnosis and treatment of disease. Periodontist, or me, conduct a number of surgical techniques to treat gum disease. So first, we're going to start with some basic info of periodontics.
Okay, so periodontist is a dental specialty involved in the diagnosis and treatment of disease.
Periodontists or periodontal dentists conduct a number of surgical techniques to treat gum disease. Let's continue on with today's news broadcast. It's hard to keep up with these fools. They keep running away. Wait, you, stop it right there. What do you think you need to accomplish to become a periodontist? Answer.
Dental school. That's all.
That's all, folks. Well, you see, it was a long process to get me where I am now today. I remember the good old days.
How exactly did you do it?
In order to become a periodontist, you need a specialized education. First, you must finish a 4-year degree program focusing on fundamental sciences. Then, you must graduate from an authorized dental school with a DDS or DMD degree and complete a residency program.
Later, you would complete a 3 or to 7 year periodontal residency program. Finally, you must pass a through qualifying and oral test to get a national board certification. To maintain your diplomate position, you must recertify every 6 years in order to become a periodontist. Back to you, Miss Know-It-All. Thank you, ladies. All this walking is making me so tired. Oh my gosh, finally a normal person. How much do you think a salary is for a periodontist?
$267,000.
Let's see if you're wrong. Come in.
Sir, pardon me, but we just received a question request from one of your biggest fans who would like to know.
What's the question?
They would like to know your yearly salary, sir.
Well, let's just say it's quite a lot.
Next, we're going to talk about the salary and wages of a periodontist. Although pay varies by location, the average yearly salary for a periodontist in Texas is $202,383. That's around $97.30 per hour, which is similar to $3,891 a week or $16,865 a month.
A lot of money. Now back to our lovely interviewer. Being an interviewer is so hard. Y'all wouldn't understand. Oh wait, person! What do you think are some benefits of being a periodontist? Answer.
They have a job, they earn money, and maybe they work with people, so they have a social life.
Interesting. Let's find out.
Sir!
What?
Dr. McBride transferred in a patient for you to do a surgical operation in 5 p.m.
Okay. Next, we're going to move on to some benefits of being a periodontist. So first, we have a high demand and financial rewards. Surgical periodontists are rewarded for their specialized expertise and vital role in oral health and dental implants. Second, we have professional autonomy and respect. They are all well known in the medical world for their expertise and talents in treating complex periodontal disorders and carrying out surgical operations. And third, we have significance difference. Periodontists are drastically improve their patients' quality of life. They do not treat severe gum disorders, which can result in the tooth loss, but they also provide cosmetic remedies to improve the appearance and function of their patients' teeth and gums.
Welcome back to our broadcast where we're interviewing people in our school. Oh my god, another pedestrian. What are some challenges of being a periodontist?
Although there are some benefits of becoming a periodontist, there's also some challenges. The first challenge is lengthy training. After graduating from a dentistry school, long and rigorous study and training are required to become a surgical periodontist. The second challenge is high initial investment. Specialized surgical tools, office space, and staff can be pricey. Additionally, the continuous expenditures of maintaining innovative surgical technology might be costly as well. And the third challenge, it can be emotionally demanding. A surgical periodontist job may be physically taxing. It involves hours of delicate procedures, many of which are conducted in confined mouth spaces.
We're going to start with some procedures. First off, we're going to start with gingivectomy. This surgery removes the gum tissue, which is called gingiva, to reduce spaces between the teeth and the gums where the germs can grow. This procedure is often used when extra gum tissue has accumulated because of the gingivital overgrowth. It can result in deep cavities that cannot be cleaned with standard dental hygiene methods.
Procedure is called gum lift, gum recontouring, or gingivectomy. What do? We basically have some teeth with some really low gum line. If we're able to remove the excess of the gum biologically, we can make more of your tooth show. That way, basically, your teeth will look longer. How do we do that? We use a laser machine. We measure how much extra gum there is and we can remove. For each person it's different. And if there's enough gum to be removed, let's say for 1 or 2 millimeters we have room, we use the laser machine. You're absolutely numb, and with laser we just basically take off that bit of gum that is unnecessary and is making your teeth look shorter. The procedure is absolutely painless because you are numb at the time. When it's finished, there is no downtime. You might feel your gums are a little bit raw, I would say, because I had the procedure done myself. They feel a little bit raw, like something was rubbed against them really hard. You have to avoid certain food like spicy, hard or hot food for a while. I would recommend a specific mouthwash to be used that is recommended by your dentist only. You probably cannot floss in those areas for a few days because when you do it bleeds, it's still healing, but after a few days time you're going to be absolutely fine. If the procedure is done correctly, it cannot cause any infection, it will not come back, and it will not cause any problems to your bone. But what do I mean by correctly? The dentist will measure how much gum there is, and they will leave at least 1 millimeter more above your bone line.
For the second procedure, we have gingivoplasty. Gingivoplasty is often done with gingivectomy, which they basically correlate with one another. It helps reshape healthy gum tissue to produce more organic form that allows for simpler cleaning. Unlike gingivectomy, gingivoplasty reshapes natural tissue to improve symmetry and the shape of the teeth.
Plasty is a simple intervention done under local anesthesia, which allows a remodeling of the gum without changing its height. This method is used above all for aesthetic purposes or to complete a gingivectomy. Just like gingivoplasty, gingivectomy is a simple procedure. However, this time the height of the gum on the tooth is modified for aesthetic or functional reasons. It is sometimes necessary to remove a tissue called hyperplastic, meaning swollen, that covers the enamel of the tooth, making the latter hard to keep in good condition or leaving a smile that isn't the most aesthetic. These two treatments can be done in different ways. Following local anesthesia, the dentist uses equipment specially designed for the removal of soft tissue. This may be an instrument that uses laser or electric currents. The goal is to give back natural forms to the gum, thus allowing them to remain healthy and to give to the smile its natural harmony.
For our third procedure is incisional surgery, also known as flap surgery. This procedure includes making incisions in the gum tissue to raise it away from the teeth and bone, resulting in a flap. This often gives a direct access to the teeth roots and supporting bone. It also allows for extensive cleaning, diseased tissue removal, and bone contouring.
Periodontitis is a disease that attacks the supporting tissues of the tooth. Its attack is at the bone level, and the damage involved is irreversible. This problem is the result of the accumulation of certain bacteria that release destructive toxins. Tartar carries microorganisms. Periodontics aims to eliminate all rough spots that impede the attachment of the gum to the root of the tooth. In the case of periodontitis that is just beginning, the treatment consists of a scaling similar to that done during the regular visits, including the tartar cleaning. The difference is that this one is done under local anesthesia so as to avoid any pain during the sampling of deposits lodged more deeply. Periodontal flap surgery is a technique often used following the failure of a less aggressive approach or when access to the rough spots become difficult because the tartar is located too deeply. Moreover, the lack of visibility adds the difficulty of removing all deposits, thus impaling the healing of the tissues. Periodontal flap surgery consists of shifting the gum to allow a good view of and direct access to the surface to be smoothed down. Bone remodeling can also be done in order to recover the natural anatomy, thus enabling easier brushing and flossing. Once the root has been freed of its imperfection, the gum is replaced and held in place with stitches or glue. Take note that certain surgeries can bring about the exposure of part of the root, which might lead to sensitivity to cold or hot foods. After periodontal surgery, it is very important to have a thorough follow-up so as to maintain healthy gums. A scaling every 3 months is usually suggested. The frequency of the follow-ups will be determined by your dentist or your specialist as the case may be.
The fourth procedure is osseosurgery, otherwise known as osteoplasty. So during flap surgery, the bones that support the periodontal affected teeth may need to be reshaped. Osseosurgery, otherwise known as osteoplasty, is the process of smoothing and reshaping the bones around the teeth to remove craters and flaws that are produced by bone loss. This allows for improved gum attachment and smaller gap depth.
When periodontitis has resulted in bone loss, it can form deep, uneven pockets around the teeth. Your doctor may recommend a procedure called osseous surgery to reduce the depth of these pockets and help bring the area back to health. These deep pockets accumulate harmful bacteria that can't be reached by normal cleaning, preventing the gums from ever healing on their own. To reduce these pockets, first your doctor will expose the area and use a hand scaler to remove the hardened deposits, called calculus, that surround the teeth and root surface. The bone surrounding the tooth is reshaped and smoothened to recreate a favorable bony architecture. Next, the area is sutured and allowed to heal. Your doctor will let you know when the area is fully recovered. Once complete, the pockets surrounding your teeth will be reduced, creating an environment where your mouth has a better chance of recovering from the damage caused by periodontitis.
The fifth procedure is soft tissue grafts. A pedicle graft involving a removal of the flap of tissue from a nearby location, maintaining one edge untouched and extending it across to cover an unexposed root. On the other hand, a gingival graft removes a tiny amount of tissue from the roof of the mouth to another location. It transfers it to the area of receding gums to protect the teeth roots and prevent future loss. The last procedure is lasers in periodontics. So lasers can be used for various periodontal operations, such as removing the deceased gum tissue, shaping gums without sutures, and sterilizing periodontal spaces to promote recovery.
That was some broad in one, folks. Get it? Never mind. Now, let's ask everyone the question we've been all dying for to know. Would you want to become a periodontist? Why or why not? Let's go ask. Would you want to become a periodontist? Oh yes, to make the world a better place. Jimena, would you want to become a periodontist? A what? Periodontist. No, thank you. Periodontist. Would you want to become a periodontist? What's a periodontist? Young ladies, would you want to become a periodontist in the future? Yes. Yeah. Hey, you right there, do you want to become a periodontist?
I don't know what that is.
There you have it. Miss McBride, would you want to be a periodontist in the future?
Who, me? No, silly. I'm a dental hygienist. Best job ever.
Well, there you have it, folks. That's it.
Well, that is all, folks. This was your local broadcast center represented by us.
Your favorite information tea area.
Make sure you follow for more.
My job here is done. But make sure you wipe off that little blood.